using Engage Consult as your workflow tool. So first of all, you can see I'm currently in the Engage client and it is integrated with your clinical system. So you can see in the left hand corner here that I am connected to my clinical system, which currently I'm connected to EMIS Web. The first thing I need to do is cover any groups that I may be a part of. So to do that, I'll go to my user account. You can see I'm currently selected covering, and I can go in and select any colleagues who are part of my organisation, who I may want to cover. But I can also go and select any groups. So these groups are set up by your organisation. So for example, if I needed to cover the admin group, the income and requests group, which is all new requests incoming, which has not been triaged, and I might want to cover the doctors group to ensure requests are being dealt with. So once I've highlighted those requests in blue, I can click save. And when I then go back to my requests by clicking requests at the top here, you can see I can now see these groups or colleagues in my list. So you have all requests, which are all requests incoming into your practice. You've got all those requests you've covered, so I can just see those requests, what I've covered from those groups and colleagues, or I can go in and just see the requests for the admin group, for example. This allows you to organise your requests so they can easily be dealt with by the right person. So for example, it allows you to assign requests to certain groups and colleagues who need to deal with them, but also we have a feature called Intelligent Request Routing. So if I just go to my management console, you can see I can set up rules to route requests to specific places. So for example, I could route all the admin requests to the admin group for them to go through, and I might want to route all the medical requests straight to the medical team for them to triage. You can also hone in on specific conditions. So for example, we're routing asthma to the nurses on this example, and any prescription queries straight to the pharmacist. So you can go in and create as many rules as you want to get those requests to where they need to be the first time. So when I go back to my requests, you can see we've had 2 new requests come in from a patient. So if I click on the request, I can go down, see the questions that they've answered. So this one was around a sick note. And there's various features around this. So I can go and open the patient's records straight from the request if I needed to go and book an appointment for this patient, for example. So I could click Open Patient Records, and EMIS will bring up that patient for me. So I can go look at previous consultations, for example. I can download a copy of that PDF if I needed to, so if I needed to upload it somewhere else, or if the patient wanted it sent on to them. I can set a priority on this request, so I can pop in if it's urgent, same day, or a routine request. So if this one was a routine request, I'd select routine. I can pop in my reason for changing the priority or just click save. And this has now been updated as a routine request. So when I go back to my inbox, you can see that the request has been now marked as routine. So anyone in the practice can see that priority that has been set. I can also then prioritise by that. So I can order by priority, and it'll bring the urgent requests up first in my list. Then it will go into same day and then into routine requests. So you can easily prioritise your workload depending on the urgency of these requests. So if I click back into that request, you can see I can also go into contact that patient. So I can select contact patient, and I have 2 options here. So I can either message the patient, or I can start a video consultation with that patient. So if I wanted to message the patient, perhaps I need more information, I can go into message patient. I can use one of my templates which can be set up on an organisation or a personal level to autofill that message for me. So for example, if I wanted to use my GP callback template, it will pop my message in there for me, and you can personalise that to the patient's name as well on your templates if you want to. And I can go in and add an attachment. So I might want to add an attachment from my computer, or if I'm an EMIS web user, I can upload from the patient's record. So for example, if there was a sick note in the patient's record, I could go upload from patient record. It will compile a list of the attachments in the patient's record for me, so I don't need to go and download it separately to then upload it to this message. And I can select what I want to send to the patient. So in this example, I'm using a picture of a rash that I'm going to be sending back, but as I say, if you had a sick note in there, you could select the sick note. So it's any attachments in that patient's record. I'm going to click add. It's now added that attachment to my message. And when I'm happy with that, I can click send and confirm that I'll be sending this message to the patient. So you can now see that message has been sent to the patient with that attachment, so they can go and view that and they can respond to that message as well. So that's our messaging feature. If I wanted to start a video call with a patient, again, I could go back to contact patient. This time I'm going to select video consultation. I can populate the patient's mobile number if we didn't have it already. I can copy the link and send it via the two-way message or in another means. And I can also click to add more participants. So I can add a second and a third participant onto the call as well. I can also send myself a link by SMS. So that's useful if I didn't have a PC with a working camera or microphone. In the practice, I could send myself a link by SMS to join that call. When I'm happy, I would click join now. It'll bring up the video consultation window. I can turn my camera on and off. I can turn my microphone on and off. And I've got the joining details, so I can go in and add more participants when I'm on the call if needed. When I've finished the call, I can click to end the call. There's various actions as well I can do around this request. So I can go to action, and perhaps I need to pass this across to a colleague or a particular group. I can go assign to and select the group or colleague that I need to assign this to. So for example, I might want to assign this across to the doctors group. Once I click save, you'll see the doctors have now got a new request for them to go in action. You've also got the opportunity to add a note to this request as well. So you can go in, again, you can use one of your templates, or you can just type in your message or your note, sorry. So you can just go and type in your note, and again, you can add any attachments to that note. And click add note. Every time I'm updating something like this, so when I'm messaging the patient, adding notes, when I go back to my full request, you'll see it's all been added. So whoever looks at this request will see the interaction between you and the patient, but also any notes, etc. added to the request. You'll also notice here we've got the waiting for patient. So obviously I messaged that patient, I'm waiting for them to read that message and respond. So I'm going to click that I'm waiting for that patient. And again, when I go back to my list, you can see that this symbol has now been added, which is my waiting for patient. symbol. So I know I'm waiting for the patient to respond on that particular request. And I can go in, use my filters and filter that out. So we've got various filters on the system. So you can do it by condition, by those groups and colleagues, by if that patient, by if we're waiting for that patient, and the request type. And you'll also notice we've got these tabs at the top here. So I can look at that full request in its entirety. I can look at the request details, just the notes, just the messages, etc. We've also got the readings tab. So anything that the patient has sent through previously using this method, we can go and have a look. So for example, if they've sent their blood pressure through, we can see the date it was sent through and the readings for that. So we don't have to go in the clinical system to see that information. We've also got the audit log, so anything I do on this request, it will be logged, or any of my colleagues, so we can see who's viewed it, who done what on this particular request. When I'm ready to send this to the clinical system, I can go to Action, Send to Clinical. I can edit any of the information before I pop it into the clinical system. And I can select and deselect as well what I want to add in. So perhaps I don't want that note to be added to the patient's record. When I unselect that, that will not now be added. Once I'm done, I'll click Send to Clinical and Complete. So once I've sent to Clinical and Complete, it'll be sent to the clinical system in the patient's record, and it will mark the request as completed on Engage Consult. You can see completed requests on Engage Consult, so you can get them back, which I will show you once this has been sent to the clinical system. So that's been sent. It's taken me back to my inbox to carry on with my next request. And you can see here, as I mentioned, you've got your open requests, so all requests still open, but you can go in and see your completed requests as well. So we just done that sick note, so I can get that back if I need to. So that's most of the functionality around dealing with those requests. We've also got the Patients tab. So you can go and get your current patient that you've got loaded in your clinical system, or search for a particular patient in your clinical system. And what this allows you to do is to see all previous communication with this patient. So all requests that have come through, whether they're open, completed. You can also see any video consultations had with this patient, or go and start a video consultation as well from this page. And then we have the management console. So not every user will have access to the management console. You can choose who does. So it'll be into your menu, and you've got your management console here. And here is where you can set up the sort of back end of Engage Consult. Please note, not everything you see on the screen right now will be available to you. Only certain ones will, which I'll go through. So for example, you have your audit log. So anything changed in this management console, again, we take a note of that so you can see who changed it and what time and date. You've got your clinical system integration, where you choose which clinical system you're with and how that Engage Consult request would appear in the patient's record. So you can choose as structured data or as PDF. You've got those intelligent request routing rules, which I went through previously. And you've got your organisation message templates, where you can go and create those templates ready for people to use when they're messaging patients. So they've got them at their fingertips. So that's everything in the Engage client. We also have the handy toolbar feature. So you can click on the two arrows pointing inwards at the top here in the right hand corner. It will open your toolbar for you, and you can drag it on the screen to wherever you want it to be. And you can see here it's telling me I've got 8 unread requests from those groups and colleagues I've covered. So it's an easy way to keep an eye on those new requests coming in from patients without having to keep checking back in the full Engage client. You'll also see you've got various functions you can just do from the toolbar as well. So if you want to start a video call, create a request on behalf of a patient, you have that functionality at your fingertips. Let's now go to that patient in EMIS and let's look how that consultation went into the patient's record. So we've got our set to going in as structured data. So you can see that request has gone in with the relevant questions that was asked. You can see the note that I took off has not been added. And you can see any attachments that were sent during that interaction also attached. This codes as an online consultation, and if there was a particular code added for particular questionnaires, they would also be added as well. Such as, let's say the patient sent through health data. When you send that health data to the clinical system, it will code directly into the clinical system for those readings.